the adrenal glands are located above the kidneys. There are two adrenal, these are otherwise called suprarenal glands. What that implies is that these glands are located above the kidneys, and these are small glands, sometimes referred to as pea-shaped glands. You know, the peas that we use in the kitchen, so it's sometimes referred to as a pea-shaped gland. But when you actually see it on a CT or mainly an MRI, we actually see it, we look for what looks like a Mercedes-Benz symbol. Means it has three limbs. It's like this. So we actually look for this gland on an image by looking for the three limbs of this gland. These are two very tiny glands nevertheless. But it's not that size can let's say dictate the function or form. The reason being, even though these are very small glands, they function their function is very important. The reason being, they secrete the stress hormones, which is mainly cortisol, but also these glands secrete what we call the other stress hormones, very important stress hormones called adrenaline, noradrenaline. All these hormones are secreted by the adrenal gland. You have a hyper-functioning situation and a hypo-functioning situation. Hyper-functioning situation leads to what we call Cushing syndrome. Again, the same thing. When we spoke about pituitary, we spoke about people presenting with a lemon on stick appearance, where they have central adiposity or a big pot belly, but their hands and legs are all very thin and frail. So the presentation is similar, and in this case also the cortisol levels are more. But the only difference between Cushing's disease, which represents a dysfunction of the pituitary, versus Cushing syndrome, which signifies that the disorder basically stems from the adrenal gland, is that it's basically a biochemical difference. We won't get into that. It may be a little more complex for the general public to understand the nuances of the differences between the two, but you get basically the same presentation. So the workup is essentially the same, but what we try and do is we try and locate where the problem lies, whether it's in the adrenal gland or the pituitary. And if it is in the adrenal gland, we do what is called an adrenalectomy, where we operate that side or that adrenal gland, and it suffices if the other gland is working, so that other gland takes the function of both, or it produces enough stress hormones to cover for the stress period. So even if we have to operate on one adrenal gland and take it out, the other gland does the job. Then sometimes we see cases with adrenal carcinoma, which is a malignant tumor or a cancer arising from the adrenal gland. Again, the treatment is where we advise the patient to operate the gland and take it out so that they can be rid of the tumor. But usually it's the mortality is very high. Very few people survive after the diagnosis of the tumor. Now, even if we were to take it out, the mortality is very high. Then moving on to the hypofunctioning situation of the gland, which is commonly known as Addison's disease. In Addison's disease, what happens is that the cortisol hormone, which is otherwise called a stress hormone or the steroid hormone in our body, there is a deficiency of the hormone, or the gland does not make the hormone. So these patients can lapse into periods of weakness, generalized weakness. They become less responsive, they feel weak, sometimes they even go into a coma, sometimes they can present with diarrhea, loose stools, etc. basically all this stems from the fact that, as I said earlier, this important hormone is not being produced enough. It can be due to many reasons. One is that, for example, if the patient has adrenal carcinoma, or if the adrenal gland has got destroyed due to infection, or a common cause is what we call an autoimmune cause for the adrenal failure. Autoimmune, when we say autoimmune, what it means is our immune system fights or destroys the adrenal gland. So we have many more autoimmune diseases that present this way. Hypothyroidism is one autoimmune disorder. Rheumatoid arthritis is one autoimmune disorder. Bronchial asthma is a autoimmune disorder. So like that, the adrenal gland can also get afflicted by the autoimmune, let's say, destruction, or broadly, these are all autoimmune diseases. So how we treat these disorders, we replace steroids in an appropriate dose. But the danger in giving these people steroids is that sometimes they can easily finding that exact replacement dose is difficult, because some of them become over replaced, so they become Cushingoid. They become as though they have more cortisol hormone in their body, which can produce problems. Or if we under replace them, the symptoms of Addison's, like weakness and all that, persist. So the challenge is to find that optimal dose, but the treatment is usually lifelong.